Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Technically, Nita, Ludwig, and I are at the Tech Slayer Center after finishing a really successful mass vaccination clinic today. With us also, we have Tom Bowman of Community Healthcare and Dr. Anderson, the medical director for Genesis Health Systems. First of all, we're going to start off with some Rock Island County numbers. Nita, let's go ahead and start with you.
Sure. So today in Rock Island County, we have 34 new cases of COVID-19, and our total is now 12,480 for Rock Island County. We have 18 people currently hospitalized in the county with COVID-19, and the death toll stands at 298. We have no deaths to report today.
In Scott County, the number of cases today is 16,545, and our deaths are at 191.
Okay, today first we'll be hearing with Nita Ludwig from the Rock Island County Health Department. Please go ahead, Nita.
Okay, I'm sorry, I thought it was on mute. I think I'm off mute now. Can you hear me okay?
I think he's still on mute.
Yes, you want to put your camera on for us? Thank you.
And then I just need the notes here quick. Sorry, we're working off a little computer today here at the Tax Slayer. So today we gave about 800 vaccinations at our mass vaccination clinic. Because of extremely cold weather conditions, we moved it to the Tax Slayer Center here in Moline. And we are certainly grateful for all the help of our community partners have given us during this mass vaccination phase of COVID-19 response. We won't make an official announcement about the location of next week's site until later this week when we have a better idea of the expected weather conditions and we can talk with our community partners. We expect to announce the site during Thursday's media briefing. We have been able to ramp up our response because of fantastic pool of volunteers from our Medical Reserve Corps. Today's clinic included 24 volunteers from our MRC and emergency medical technicians from the Moline and Rock Island fire departments. We also received logistical support from the Rock Island County Emergency Management Agency and deputies from the Rock Island County Sheriff's Department, and of course, our dedicated public health staff at the Rock Island County Health Department. We will continue our online system to register for the time slots for our vaccination clinics. However, we are changing the registration day and time for the second dose of the Moderna vaccine for next Tuesday's clinic. In total, we expect more than 800 Moderna vaccine doses will be available for February 16th, but we hope to give more. We won't have an exact vaccine total because we are waiting for the Illinois Department of Public Health to give us our allocation amount later this week. The February 15th clinic will be a Moderna second dose clinic to match up with the people who received their first dose on or before January 16th. Residents who received their first dose of the Moderna vaccine on or before January 19th will be eligible to register this Thursday for that second dose. The link for the second doses will go live on our Facebook page and on our website at 10 a.m. on Thursday. It will remain open until 3 p.m. or until all the slots are full. This is a day earlier than we had made the doses available in the past, and we will post a link to the slots on our website, but we strongly suggest that you use the Facebook link because Facebook can handle the number of people who are trying to get on that page. Our website did crash last week, and we are working with our web host to improve that stability. This is a change from what we announced last week because we are attempting to prevent a bottleneck of those second dose patients. We will announce any changes as necessary to our media partners and on our social media page, and of course on our website. And we've said throughout the pandemic, we are in a quickly evolving situation. We still are using Sign Up Genius for the slots. You do not need a Sign Up Genius account. For first dose, just click the slot that's open and put your name and email address and click submit. Be sure to click submit or you will not have that slot reserved. For the second dose people, you still need to sign up for, again, you still do not need to sign up for an account, but you will be asked 2 qualifying questions that will require you to tell us when you received your first dose and to make sure what brand you received as your first dose. This information is available on the vaccine card you received when you got your first dose. Then you will need to put in your name and email and again, click submit for that time slot. If any doses remain available, we will open those doses for first dose patients at 10 o'clock on Friday using a second link. This link will also be available at our Facebook page and our website. There is no guarantee that first doses will be available because almost 900 people received that first dose on January 19th. To be admitted into the February 12th clinic, you will need to show your vaccine record card, your registration email for this February 16th clinic, and of course your ID. A consent form is available on our website, richd.org. We suggest that you do fill that out before you come to speed along the process, but we will have them here if you need one. As a reminder, the CDC says that second doses should be received by 42 days after the first dose or as soon as it is available. The optimal interval is 28 days for Moderna and 21 days for the Pfizer. We are balancing first and second doses with the small amount of vaccine coming into our county. We received 2,450 doses this week to use ourselves and to share with our vaccinating partners. Phase 1B includes 65,000 people in Rock Island County. And again, it will take months to complete. So we could ask for your continued patience on that.
Thank you. Next, we will hear from Ed Rivers with Scott County Health Department.
It seems that the only constant through this pandemic has been change. In planning our response, these constant changes have forced us to reevaluate and redefine our programs and methods on a daily, sometimes hourly basis. We're reporting today a change that may help to bring some stability to the immunization effort in Scott County as we move forward. Late last week, the Iowa Department of Public Health announced that it would be guaranteeing a stable supply of vaccine to each county for the remainder of the month of February. Prior to this, each county waited to hear weekly which vaccine they were receiving and how many doses would be received. Now that we know the type of vaccine and the amount of vaccine we'll be receiving for several weeks, we can establish a process that will be consistent for our community. Since first receiving shipments of vaccine, a portion of our weekly allocation has been provided to our healthcare system partners to administer to their healthcare providers in phase 1A, and then to their patients 65 years and older in phase 1B. This was to increase the number of people administering vaccine to get vaccine in the arms, as is the directive from the Iowa Department of Public Health. As the adage says, many hands make light work. In the first week of phase 1B, the portion of our allotment we retained for administration at our Sears clinic was divided between persons 65 and older and those in Tier 1, as instructed by the Iowa Department of Public Health. In order to quickly administer the doses we reserve for those 65 and older, we made them available through a public enrollment on our website. As has been the case locally and across the country, this led to a frantic scramble for those precious few doses, technical difficulty, frayed nerves, and disappointment. Technical challenges have been resolved, but the fact that very few doses will be available for a large number of people hoping to attain them will not change in the near future. Although the enrollment achieved our goal of quickly administering all the doses available, we feel that continuing this method is not the best way to serve our community in these turbulent times. Beginning this week, all vaccine for the 65 and older priority group in Scott County will be provided to our 3 community-wide health systems, Genesis, UnityPoint Health, Trinity, and Community Healthcare Incorporated, for administration through their clinics. This has many benefits. Providers have existing processes in place to give the vaccine due to their participation in the Phase 1A healthcare worker immunizations. Patients and their contact information already exist within these systems, and scheduling for appointments is already included in how they do business. Providers have relationships with their patients and are a trusted resource for health information and services. And it will eliminate the need for people to access vaccine through a computer-based system, which is especially challenging for many in the 65 and older priority group. We recognize that not everyone has a primary care provider, and not every primary care provider in our community is connected with these 3 health systems. The Center for Active Seniors, CASI, has agreed to continue to help seniors in our community as we move forward. People 65 and older who do not have a medical provider or a provider who is not a member of the 3 health systems can contact CASI at 563-386-7477 for help to get connected to this new vaccination process. If you've already called CASI for assistance, you do not need to call again. We appreciate CASI's willingness to partner with us in this effort. For the week of February 14th, the number of doses available is 2,250, of which 1,900 will be transferred to healthcare providers for people 65 and older, and 350 will be reserved for administration at our Sears Clinic for healthcare workers not yet vaccinated and individuals in Phase 1B, Tier 1. People 65 and older will be immunized throughout Phase 1B. At the same time, immunizations will be conducted for those priority groups in the Phase 1B tiers. Our department will be directly contacting groups in those tier designations. This schedule was set by the Iowa Department of Public Health, and we're required by law to comply with that. Many extremely difficult prioritization decisions have been made due to the limited amount of vaccine. For most people in the 65 and older priority group, this will be the process by which you receive your immunization. Others may wish to actively search for vaccine outside this program. A very limited supply of vaccine is slowly starting to be allocated to local pharmacies by the state and federal government. The pharmacies involved will be in charge of the registration and administration. The supply in these pharmacies will be very small, and we don't expect that a large number of people will be vaccinated through these systems in the next few weeks. What we hope people can take away from today's announcement are the following messages. Our supply in Scott County will be stable. Healthcare providers will reach out to their patients 65 and older to schedule immunization appointments. People 65 and older who do not have a provider or a provider who is not a part of these 3 health systems will be supported by CASI in getting vaccinated. And vaccination of Tier 1 priority groups will occur at the same time. We're extremely grateful for our healthcare partner and the many roles they played throughout this pandemic. They're rising to the occasion again and will be immunizing large numbers of residents in our community. I welcome all 3 partners to our briefing today.
First, we will be hearing from Dr. Kurt Anderson, Senior Vice President, Physician Operations and Chief Medical Officer for Genesis Health System.
Thank you. I'm happy to join today, and I appreciate the comments by the leaders from the health department. And I think they set up the talking points very well. You know, we're excited at Genesis to be part of the solution for our community. It fulfills our mission to care for our community, and we're really fortunate to do this together with community healthcare and with UnityPoint Trinity. We feel that we have great working relationship with our local health departments in both Scott and Rock Island County, and that's allowed us to actively participate in the 1B, and it also made it very efficient for us to immunize the healthcare workers in the 1A group prior to this. So as was mentioned, we'll be focusing on the over 65 population portion of the 1B. We have relationships with many of those patients, and we'll work with CASI and make sure we take care of the patients who may not have an established relationship with the healthcare system, as Ed described. We know these patients. We already have large rosters. So we have had more than 12,000 patients registered by our physicians, and we continue to register patients. So we have our patients covered. That's the message I want to let them know, that we will get to you. I would reinforce that it is going to take many weeks to get through the 1B group, the large population, and we have limited vaccine supply. We're hoping that this weekend, in the weeks ahead, that we'll be able to administer somewhere around 1,000 vaccinations in Iowa and a similar number in Illinois to the 1B population. Our goal is to make sure that when we have vaccine and we receive vaccine, that we can quickly administer that and get it distributed so that by the next week's allocation, we've completed the previous vaccinations for the first vaccine in that 1B group. So our commitment is to turn around the vaccine within that 1 week period so that we're ready for the next shipment and we can continue moving through the list. It will take weeks. We hope that the vaccine supply will continue to increase in the weeks and months ahead so that we can go faster. We have capacity to do up to 1,000 vaccinations a day between our Iowa and Illinois locations. We just don't have the supply to do that right now. But as the supply increases, we'll ramp up to that level and beyond if need be. In addition to participating in the 1B vaccinations for the 65 and above group, we're partnering with the health departments just like UnityPoint and CHC to support community efforts around vaccinating the priority groups, the tier 1, as was mentioned in Iowa. And we're happy to continue that partnership through support of staff for the community clinics and through use of our occupational health team for some of the employer immunizations for the priority groups. So we'll continue to do our part. And again, I am very happy that we're able to meet our mission to care for our community and do that in partnership with the health department, UnityPoint, and community healthcare. I will just take one question from the chat while I'm on my time. There was a question about flu season, and I'd welcome any further comments from the health department team. But the question was, how's the flu season going? It's been a light flu season, and we see that. Are we seeing that here? And the answer is yes. It's been a very light flu season. We've had minimal flu cases across our clinics and in our hospital. The other part of the question was, how were vaccination rates? Our vaccination rates for influenza this year were similar to previous years. But what we're seeing with a very low flu season is what we know will work for COVID and has worked for COVID. When we avoid large gatherings, when we wear our masks, and when we practice, good hand hygiene, we can prevent the spread of viruses like COVID and flu. So that's what we have to continue to do as well while we work through this vaccination process. This is absolutely the wrong time to let up our community efforts around stopping the spread of viruses in our community, both the flu virus and the COVID virus. So I would just continue to remind everyone, wear your mask, maintain social distancing, avoid large gatherings, and wash your hands.
Thank you. We could not have said that last part better ourselves. Thank you very much, Dr. Anderson. Next, we'll be hearing from Tricia Fisher, the UnityPoint Clinic Director of Operations for UnityPoint Health Trinity.
Good afternoon, everyone, and thanks for having me as well. Here at UnityPoint, we are fast and furiously working through getting patients scheduled and into our clinics. Again, we are very grateful to have this partnership and to finally have the ability to vaccinate some of our patients in the community within our own clinic sites. Our goal is to, at this point in time, we have one location on the Iowa side and one on the Illinois side. And we've really kind of had a focused strategy on, instead of spreading out these vaccines into multiple different sites, of having just kind of one streamlined process within those clinics to be able to vaccinate our patients. We started that this week in Scott County with the allocation, and we are ready to go as soon as we receive our vaccine on the Illinois side this week. Our Iowa clinics are going very well. Patients obviously are extremely grateful to have the opportunity to be vaccinated, have commented throughout on kind of the smooth process that we are all using to get these patients in and out quickly. And as Dr. Anderson mentioned, just moving through the vaccine as quickly as we possibly can to get these patients through. The other piece I'd really like to kind of touch on is how we are communicating out to our patients, and some of you guys have alluded to that already. We at UnityPoint would ask that you wait to hear from us as to when it is your turn for the vaccine. So we know that we have a lot of patients calling our clinics. We would ask that you wait until you receive communication from us to say that it is your turn to come into one of our clinics to be vaccinated. And we are doing that through a couple of different means. Based on really kind of the age population, obviously the older population not being as familiar with technology, most of those were actually calling from our clinics in a centralized location and the PCP offices. We are calling those patients to get them scheduled. We also are keeping kind of a real-time list. So we have all of our patients that have a PCP with UnityPoint Clinic. And as soon as we make contact with those patients, we mark their status so that we don't have repeat phone calls. So we know the patients that have declined, those that have scheduled, those that have maybe already received it in other locations. So we keep track of that so that we have all of our staff working on that and know kind of real time what's going on with each of those patients. The other means that we use and will use a little bit more as we move into our younger population will be through a text message strategy. And that is really a push of a text message out to patients that includes a scheduling link. So similar to what you've done at the health department, we'll have a link that they can click on. We'll show them all the available time slots and the locations, and they'll be able to schedule their appointment from there. We know that that doesn't work for everyone. So of course, there will be another option where if you cannot receive a text message, you would receive an automated phone call that would basically give you guidance as to what phone number to call back to schedule. Sometimes that phone number may be your primary care office that it directs you back to call. And we'll also have some centralized numbers that we will use for patients to schedule as well. So again, appreciate the time today. Most of our focus again is really kind of on the 65, obviously the 65 and older population. And as we get more vaccine, our strategy is looking at first, age as well as stratifying based on comorbidities. And we can do that all off of our patient list as far as the information that we can pull out of our electronic medical record system to be able to stratify who we reach out to first to get scheduled in these clinics. So again, thanks for the invite, and it's been a great partnership, as Dr. Anderson said, working together with our community healthcare systems as well as Genesis and CHC and all of our independent providers. So just looking forward to the future and what we can continue to make happen for our patients and community. So thank you.
Thank you very much, Tricia. And lastly, we will hear from Tom Bowman, CEO with Community Healthcare. Thanks, Tom.
Good afternoon. Again, echo many of the comments. I think one thing to note is just this is not common in every community of our size where you have multiple health systems and health departments working in collaboration like we've seen here in the Quad Cities. And it's just, I have colleagues across the state of Iowa and across the state of Illinois that just are having much more difficulty in those communications. So it's been really an example set, I think, for other areas at how well the Quad City community has bonded together on these things. When we focus on the 65 plus, especially, so starting with Scott County, we're really running two different programs sort of between Iowa and Illinois. But on the Iowa side and the work in Scott County, we have identified the 65 plus group who are currently patients of CHC. We will be reaching out to them via text messages and also emails and or phone numbers as needed. We will prioritize those who are of higher risk with multiple comorbidities as well. If a patient of CHC is worried about whether or not they are on the list, we assure them they are, but if they want to, they can go to our website at www.chcqca.org, and they will be asked to fill out some clarifying information, and then they will be placed on a wait list so they can ensure we have the right phone number or email or other contact information for them. So that is available. If patients are unable to use the internet or they have difficulty, we would ask them to reach out to a friend or family member first, and as a last resort, call the clinics at our main scheduling line, and they will be assisted from there. But we will reach out to our 65+ patients as vaccine is available, and we will work through that group just as quickly as we can. On the Illinois side, we have been running vaccination clinics for 1B in partnership with Rock Island County, and have done a great job there. We're doing 800 to 1,000 doses every weekend, and have done so since vaccines started coming to this community, and just very proud of that effort. That is for both community members and established CHC patients. So again, for those that are in that 1B group and reside on the Illinois side, they can go to our website. They will be screened and placed on a waiting list. When vaccine is available, they will receive a link to sign up to come in and receive their dose. One other comment that I just wanted to highlight, today there was a national press release from the White House saying that community health centers across the country will start to receive direct shipments of vaccine. We had calls with the Health Resources and Service Administration today. That is going to ramp up very slowly. They are starting with 25 health centers out of 1,300 starting next week, and they did not give an indication of how quickly they will expand that group. So that vaccine won't be coming directly here to the Quad Cities in the very near future, but we hope within the next few weeks we will be included in that expansion. They are hoping to be able to do about 1 million doses a week through federally qualified health centers. So we will be on that list eventually. The idea is that that will help enhance the amount of vaccine coming to communities, and FQHCs are particularly poised to serve underserved populations and be able to solve some of the equity issues and that sort of thing. And so we will focus there, but we will also continue to partner with both health departments and provide those extra clinics as we have been so far.
Thank you very much, Tom. And for our media partners, I know we've thrown a lot of information at you today. I am going through the chat here to see if there's any questions that we still need to ask, and we will get to those. If you have any additional, please type them in. Ed, I do have one question here for you. I'll wait when you jump on. Does the Scott County Health Department have a reaction to the news that Governor Reynolds did not consult with the Iowa Department of Public Health before changing the mask mandates?
Well, as we've noted all along through the pandemic, masking up, washing your hands, staying home if you're sick, these are all matters of personal responsibility. I believe that the community in the Quad Cities and Iowa at large understands that now. The governor's office indicated they still strongly encourage masking, as did the Iowa Department of Public Health, and we've reiterated it every opportunity. The time for moving away from these public health measures is not yet, even though we have vaccine in our community. The level of herd immunity that would prevent passing the disease without these measures has not yet come. So we encourage everyone to continue to wear masks and to behave in a way that will protect our community and not transmit the illness.
Thank you. And I think you did address the role the health department will be playing now in terms of working with the non-65+ priority groups in phase 1B. And so that information is there, just checking to see if there's any additional. What did the officials from the hospital think of Reynolds' decision? Dr. Anderson or Tricia, would you like to address that?
Yeah, I'll take first stab at it. You know, I've made my comments, I think, clear in the opening statement. We're not there yet. We still need to do all the preventive measures that we can to continue to slow the spread of the virus in our community while we work to get the vaccination process done, which will take weeks and months to get done. So we absolutely support use of masks and social distancing, staying home with when you're sick. We've changed none of our policies in our clinics or in our hospital around masking. It's mandatory if you're going to be in our facilities, and that's not going to change until we are at a point that the virus is not active in our community, and we are absolutely not at that point yet.
I would echo what Dr. Anderson is saying. I mean, we have not changed any of our policies either. Same, PPE requirements and things that we've had all along. And, we hope that, people respect us for that. And certainly, we respect others' decisions as well. But yeah, I think the focus remains the same as it always has been. And we don't feel like we are at any point in the game to change course yet. So we will keep going as we have been all along, until things change more drastically than what they have.
Well, thank you very much to Dr. Anderson, to Tricia, and to Tom for joining us today. We're very grateful that you spent some time with us to share this important information with our community. We will be posting a copy of this press briefing on the Scott County Health Department's website under COVID-19 news. There will also be a copy of the press release that will go out shortly after this that Janet will send. It will be just a bit delayed today as they are still finalizing things at their clinic site. They will also be posted on our social media pages, so please continue to watch there for updates and information. And we appreciate the media partners who are able to join us today. We appreciate your support in getting this important information out to the community, and we will continue relying on you in the days ahead as we receive more information and updates on vaccine in our community. Thank you all for your time and have a good afternoon.